In New York State, more than 10,000 people have died from the coronavirus in just a month, most of them in New York City. Our lead national correspondent, David Begnaud, is there outside Mount Sinai West Hospital. David, good morning. So what's the latest on hospitalizations in the New York City area?
Well, the governor said that coronavirus has not overwhelmed the hospital systems here in the state and that they have controlled the spread. But I'll tell you, 2,000 people are still entering the hospitals here in New York State every day with coronavirus symptoms. The latest 24-hour death toll was 671.
New York's Governor Andrew Cuomo provided the graph, which appears to show hospitalizations statewide have plateaued.
And I believe we can now start on the path to normalcy. If we continue to be smart going forward.
Yesterday, we told you that public health officials in New York City are telling medical providers to only test people who are hospitalized with COVID symptoms because the swabs that they use to perform the tests are running low. We called the only U.S. manufacturer for those swabs, which is a company based in Maine, Puritan Medical Products.
You have two shifts working 10 hours each. That's 20 hours a day, 6 days a week.
Yes.
Is that enough?
No, but you have to respect your employees. Today, the demand is greater than what we can produce on a weekly basis.
More than 1,000 miles west of New York City, in Sioux Falls, South Dakota, coronavirus has closed a pork processing plant. And that could affect the nation's meat supply chain, according to the company's CEO. Almost 300 people working at Smithfield Foods tested positive for the coronavirus. South Dakota's governor is resisting a stay-at-home order for Sioux Falls, even as the state's cases rose by more than 200 2 days in a row. Back in New York, where the daily death toll has been at or above 700 for most of the last week.
I'm losing control. I'm getting everything done at the wire.
Pat Marmo is struggling to meet the demand. He's a funeral director who owns 6 funeral homes in New York City.
My phone is ringing probably like twice a minute.
He calls himself one of the last responders.
We're moving an average of anywhere between 30 and 40 cases a day. I'm trying to get caught up. I'm playing catch up, but I can't catch up. When this first started, I was just pushing social distancing. As long as they stood apart from themselves in the chapel, I would prepare their loved one. We would do a COVID embalming. We'd give them an open casket. We even have a cosmetician come and a hairdresser. Now, we don't have time for all that because we have another family waiting to use that chapel. It's not slowing up. It seems like it's getting worse. It might just be me, and I'm hoping I'm wrong. This is one time I want to be wrong.
Outside of one of Pat's funeral home yesterday, we met a woman who told us she waited nearly 30 days to find a funeral home who could receive her sister's body and prepare it for burial. Tony.
David, thank you very much.